Hari Om everyone, I'm Ramya and welcome to the presentation on PMS and yoga therapy. PMS or premenstrual syndrome is a condition that describes the physical and or mental disturbances or symptoms faced by about 90 to 95% of the women on the planet in their reproductive age during each menstrual cycle. Now, a woman goes through 4 phases during her cycle every month. First is menstruation, then pre-ovulation phase, and the last one is the premenstruation phase. PMS falls in this last phase about a week or 10 days before the actual bleeding starts and after the egg is released to either be fertilized or to let go in case of non-pregnancy. Most of these symptoms will usually resolve themselves at the onset of menstruation. It can start as early as mid to late teens and will go all the way up to mid 40s just before she hits her menopause. Now coming to the symptoms, various symptoms ranging from physical ones like moderate to extreme fatigue, headaches, cramps in the abdomen and legs, insomnia, acne, etc., to mental or emotional ones like depression, irritability, lack of self-worth, feelings of lack of self-worth, wanting to stay away from society, being overwhelmed at what life throws at her during this time. One of the very common ones you will hear from women are sudden bursts of anger or crying spells and bloating and food cravings. Now, the symptoms and their severity vary from woman to woman and even cycle to cycle and can range from very mild to moderate to very severe that can disturb their day-to-day activities. There aren't any known specific causes for the condition, but some factors like fluctuation in hormones like estrogen and progesterone, and consequently serotonin are known to cause it. Also, any existing mood disorders like bipolar disorders or clinical depression make these symptoms worse. And of course, the day-to-day stresses and unhealthy or disturbed lifestyle will also lead to these symptoms. Coming to the treatment, most of these symptoms, as mentioned before, will usually resolve themselves on the onset of menstruation, but there are some times that they are known to continue, and in such cases or where the symptoms are very severe, she's prescribed painkillers. Some of the other options are antidepressants, contraceptives, hormone therapy to balance the hormones. She can also look at some of the alternative options like homeopathy and acupuncture. Before we go ahead with the different yogic practices, here are some of the things that will help her deal with PMS in a general sense. One of the most important things that she can and should do is to track her period or her cycle. What this will do is bring some sort of understanding of the changes that are happening in her body, and it can also be used as a tool to prepare her better to deal with these symptoms. As with the 4 seasons of the planet, there are 4 seasons within a woman's monthly cycle that correspond with the 4 phases that I talked about at the beginning. So PMS falls in the inner fall or autumn, where the body is ready to wind down and rest, and the symptoms are a clear indication for her to do the same. So paying heed to them. Say, for example, fatigue is an indication to pull back and relax. So therefore, it is important to know and understand, accept and acknowledge her body and the changes that it goes through and will go through each cycle, each month, each week, each day, in fact. So just understanding that is a first step to healing her PMS symptoms or any other menstrual irregularities for that matter. Having said this, it is important to keep moving. Physical activity will secrete the happy hormones and endorphins, and these will keep most of the symptoms at bay. Now, this is a time when some women aren't really interested in being active because of the symptoms that we talked about, but anything as simple as a walk in the nature, simple yoga practices, or even dancing sometimes will help and relax and reduce the stress and anxiety, etc. The final one I would like to add here is to inform the family or the people who are regularly around her life. that yes, she is going through this phase or these symptoms, which will allow them to understand why she's behaving the way she's behaving, instead of being confused. And this will also help them support her in any way they can and make life easier for everyone involved. How can yoga therapy help? Um, Now that we know the symptoms and the causes, it is very easy to understand the benefits that a woman can derive from a yoga practice to handle the situation, be it asana, pranayama, yoga nidra, and all other practices for that matter are known to help with the symptoms that we discussed before, like stress and hormonal imbalances. But one of the most important benefits would be the awareness the yoga practice brings to a woman about how her body and mind function. This knowledge combined with the yogic practices will definitely bring about the healing that is needed here. Now, coming to the specific yogic practices, asana, depending on the kind of symptoms a woman is going through during this phase, asana practice can vary widely. But as a general guideline, some form of forward bending asanas that will allow her to reflect and look inward, because this is a time to surrender and let go. As she's getting ready to wind down. So poses like child's pose and Paschimottanasana, etc. Balances for stability in mind and body like Ekapada Vrikshasana, back bends which are mild to moderate to stimulate the reproductive organs, as well as for depression and anxiety, so poses like Cobra pose, Dhanurasana, etc. And finally, inversions and poses that ease the tension and congestion in the pelvis and stimulate reproductive and pituitary glands. So poses like Sarvangasana, Halasana, spinal and supine twists, Supta Baddha Konasana, etc. Another thing is just a reminder that these need to be done with slowly and with support as is called for. So pranayama, mudra, meditation, yoga nidra, and chanting practices need to be done not only during this phase but every day to get the long-term benefits. So pranayama that helps her relax, like Nadishodhan, Ujjayi, Brahmari, Yoni and Ashwini Mudra for better function of endocrine and reproductive systems, Vaman to release the emotional tension that is being held in the body, Kapalabhati, Neti, and other cleansing practices like Laghu Shankha Prakshalan will help with almost all the symptoms. Omkar chanting, Mahamrityunjaya, Gayatri, and Durga Mantra for relaxation, healing, strength, and focus. And most importantly, Yoga Nidra, which is specifically catered for PMS or even the normal ones that are done for insomnia, etc. And this needs to be practiced every day again. And most importantly, following yamas and niyamas, not only during this phase or condition, but again throughout her life and her cycle, to take care of herself, her body, and bring stability to her mentally. And of course, sattvic diet is a must throughout her cycle in order to keep the symptoms at bay. So fresh fruits, vegetables, foods that are light on her digestion to ease the cramps and constipation, etc. Avoid any processed or oily foods, sugars, fats, dairy, caffeine, alcohol, etc. Now, interestingly, this is the time that she is going to crave for the very foods that she needs to avoid. So knowing that yes, she is going to crave them beforehand and being disciplined about it throughout the cycle is going to help. Coming to the contraindications, these will depend again on the symptoms, but generally avoiding a dynamic asana practice or cleansing practices like Laghu Shankha Prakshalana or Kapalabhati in case of cramps or fatigue, for instance, need to be avoided because they'll only increase the symptoms than help her. Therefore, we need to make sure that we know the symptoms before a certain practice is recommended. Finally, to conclude, having awareness of the body's functions and the changes it goes through each cycle, and understanding the sort of intuitive messages that it gives, provides a woman an opportunity to bring positive changes to her lifestyle. And of course, inclusion of yogic practices will, without a doubt, bring more balance and harmony, not only at this time where she's usually not able to connect with herself, but also through all her phases, allowing her to nurture and celebrate her body and treat it as a companion in her journey through life. And with that, I would like to finish. I hope this shed some light on the condition. So I will thank you and Hari Om.